First of all, pain after surgery to a certain extent is completely normal. It has a warning function, it indicates recovery and is to be expected, and depending on the type of surgery, we're expecting different pain levels. However, pain is an individual experience, so it's influenced by various factors and, for example, expectations. And if you expect before the surgery to be in pain after surgery, you're also more likely to experience pain after surgery. And what is also important is if your expectation, it doesn't matter if it's positive or negative, are met after the surgery. And like in the past, for example, we were advertising with pain-free hospitals, and this is like a completely unrealistic expectation for patients, so they were often violated. However, we are not completely in control of our expectations. There are also ways of positively influencing our expectations. There are a number of studies who show how important our expectations are for our postoperative pain perception. And we also already know that our emotional state is important here. For example, there was a study who showed that especially women undergo major surgery are more anxious. And if you're like more anxious, you're like expecting to have more pain, and in the end they had more pain after surgery. But there are also different studies who looked for intervention on how to reduce negative expectation and inform positive expectation. For example, consultation with a doctor or the physician might help, and also discuss about the expectation, and especially set realistic expectation might be helpful or might be important. And one of our colleagues from Hamburg showed in a great study that also the combination of a targeted information by the surgeon and a visualization of medication intake via an app, for example, might help to positively influence expectation, and then in the end also to reduce pain after surgery. And I think there are also interesting new possibilities, for example, using placebo effects in terms of giving patients openly administered a placebo, so they know they're getting a placebo as an add-on to the actual pain therapy. And this might also help. And actually now we're investigating this in one study, so patients getting a placebo openly administered before surgery, and we see if we can influence the expectation and also their anxiety. First of all, patients might keep in mind that it's completely normal to be concerned before an operation and also to the postoperative phase. And depending on whether you have positive or negative expectation, different approaches or intervention might help. So for some, it might be helpful to have like a really detailed explanation of what is going to happen, the type of surgery and the postoperative phase. And because the idea is if you know what you can expect, then you can prepare for it. But for some others, it might be helpful to decline a really detailed information and explanation. And for others who already know that they're really sensitive to pain or they experience really high pain intensity, for example, if you already have chronic pain, then I definitely would recommend to discuss this with the treatment team, because you might also use some anesthetic procedures, for example, regional anesthesia, who like better control your pain in the postoperative period. And it might also be helpful to manage expectation or try to manage the expectation on your own. So you might ask questions like, where do my expectations come from? Am I maybe afraid, or what do I need, or what I need to do, or what do I want now? And then use trustworthy information or have a consultation with the physician. And after the surgery, it's really important that you communicate how you feel and what you need, and also, of course, take the pain medication which is given to you.